Hello, my name is Brenda Urbina, and today I will speak to you about stomach cancer. Let's begin with some medical terminology. Stomach cancer is also known as gastric cancer. The root word for gastric is gastra, which means stomach. The suffix is ix, which means pertaining to. Gastric means pertaining to the stomach. Cancer is a disease in which abnormal cells divide without control and can invade nearby tissue. According to the Anti-Cancer Fund, stomach cancer is a cancer that forms in the tissue lining of the stomach. Most stomach cancer starts from cells in the inner layer of the stomach, the mucosa, which normally makes and releases mucus and other fluids. These cancers are called adenocarcinoma and represent about 90% of stomach cancer. Symptoms are broken down according to the stage of the cancer: early stage stomach cancer symptoms and advanced stomach cancer symptoms. In some cases, individuals in the early stages don't experience any symptoms. Symptoms appear just of that of a common stomach ache. Symptoms include unexplained weight loss, abdominal pain, indigestion, heartburn or vomiting, loss or decrease in appetite, weakness or fatigue, blood and vomit or stool, and a feeling of fullness after small meals. Advanced stomach cancer symptoms are more intense due to the cancer spreading to other nearby organs, including the liver and large intestine. Signs of blockage in large intestine include loss of appetite, significant weight loss, and uncontrolled vomiting. Signs the stomach cancer has spread to other organs, such as the liver, include jaundice, yellowing of the skin or eyes, and enlargement of stomach from the fluids. Diagnosis for stomach cancer begins when a person sees their doctor. A physical exam is conducted, which includes questions regarding symptoms, family medical history, and physically feeling the abdomen region for abnormal changes. If the doctor suspects any abnormalities, the doctor will refer the patient to a gastroenterologist. The main test conducted is an upper endoscopy. Doctor passes an endoscope, which is a thin, flexible, lighted tube with a small video camera on the end down your throat. Other tests include an endoscope ultrasound, biopsy, imaging testing, CT or CAT scan, MRI scan, and a PET scan. The staging system most often used for stomach cancer is the American Joint Committee on Cancer, which is based on three key pieces of information. 1. The extent of the size of the tumor. 2. Spreading to nearby lymph nodes. And 3. The spread to distant sites. The earliest stage stomach cancers are called stage 0, and then range from stage 1 to stage 4. The lower the number, the less cancer has spread. The higher the number, such as 4, means the cancer has spread and is harder to reverse. Those who are at main risk for stomach cancer are individuals with a family history of stomach cancer, GERD, and obesity. Other risk factors for stomach cancer include a diet high in salty food and smoked foods, a diet low in fruits and vegetables, tobacco use, environmental exposure to dust and fumes, and long-term stomach inflammation. According to the U.S. National Library of Medicine National Institute of Health, gastric cancer is more prevalent in males. In developed countries, gastric cancer is 2.2 times more likely to be diagnosed in males than in females. In developing countries, this ratio is 1.83. It's also been found that stomach cancer has a higher prevalence rate in developed countries. In the United States, the 5-year survival rate is 31%. This rate is based upon most cases of stomach cancer are unfortunately diagnosed once the cancer has spread, which is the metastatic stage. The 5-year survival rate for pre-metastatic diagnosis is 67%. The most common treatment for stomach cancer is surgery. This treatment applies to all stages of stomach cancer. The two types of surgery that are done are subtotal gastrectomy, removal of a part of the stomach that contains cancer, nearby lymph nodes, and parts of other tissue and organs near the tumor. In some cases, the spleen is removed as well. There's also total gastrectomy. This surgery includes the removal of the entire stomach, nearby lymph nodes, and parts of the esophagus and small intestine and other tissues near the tumor. Again, in some cases, the spleen is removed. Other treatments include chemotherapy, radiation therapy, chemoradiation, targeted therapy, and immunotherapy. There are steps you can take to reduce the likelihood of stomach cancer. Exercise. This is associated with the reduction of stomach cancer. Eating more fruits and vegetables, choosing a wide variety of colorful fruits and vegetables, reduce the amount of salty food and smoked foods, stop smoking, and of course, visit your primary doctor. Thank you for your time and learning about stomach cancer.